Dr. Alexander, we're here to talk about MS and cerebral endothelial dysfunction. Can you tell us a little bit about what cerebral endothelial do? What is a normal function?
Well, normally the function of the blood vessels in the brain is to maintain a surface for blood to actually reach the tissues, and that normally means that it's not a sticky surface and that it keeps everything inside of the bloodstream. And one of the things that we know that happens in multiple sclerosis is there's a change in the complexion, if you will, of the vasculature. The blood vessels change, they become sticky, they become leaky, and all of these things contribute to the development of stress in multiple sclerosis.
And how do you know that?
Well, we can look for various different markers that we see. Okay.
Let him hit that again.
Sure.
How do you know that, how are you discerning this difference?
Well, a lot of the people at this meeting are showing a lot of radiological evidence for it. Some of the things that we're looking for in my laboratory are endothelial microparticles, and these are actually little bits of the surface lining of the vasculature that actually comes off during active disease. And so one of the things that we're looking at is whether or not we can measure these, what particular properties those have, what particular proteins they have, and can that be used to identify if the disease is getting worse and if patients are responding to therapy.
How is it related to MS?
Well, these changes take place during MS. And when we see that these particles, these microparticles, are increased during active MS because they carry markers that come from the blood vessels, we're sure that they're derived from the blood vessels. And when you have blood vessels actually breaking down in this way, that could contribute to the development of vessel injury and the leakage of the blood-brain barrier that's characteristic for multiple sclerosis.
How is this applied to the venal system?
To the venous system? Well, one of the things that we know that goes on in multiple sclerosis is the development of a perivascular cuff. And that's something that is seen radiologically. You see these leaks that occur in the veins, and this is a characteristic marker of the injury. And that's something that happens when these blood vessel lining cells can break down.
Can you give us just basically a bit of a synopsis on your work in a very layman's terms and sort of explain to us why it's so critical to the world of CCSVI overall?
Why work on the venous side of the system is?
Yes.
Well, because we are seeing disturbances in the venous side of the circulation. Some of the work that I'm going to present today suggests that remodeling of some of these vessels actually contributes to the development and worsening of that injury. We don't know exactly how everything gets going, and one of the controversies in CCSVI is that there's a vascular component that contributes significantly to the development of the injury, and that's something that we see in the alteration of these blood vessels, and evidence is mounting that this may be a significant contributor to the disease. So I'm looking at some of the cellular mechanisms through which that might take place.
What's the most critical takeaway for people to understand about your work?
What we're hoping to do is we're hoping to identify new tests for seeing whether or not someone is actually developing MS, and to try and develop an unbiased method for evaluating if they are getting better in response to several different treatment options that they might have. Another thing that we're interested in finding out is how do these markers correlate with CCSVI, and that might provide some additional strong evidence that CCSVI contributes to this injury.
Where are you in the course of your research at the moment?
We have several patients already enrolled. We have several patients already enrolled who started out without therapy. We took samples, and now we're following them through several months of their therapy and re-examining their microparticles at different points in time.
So what's the next steps? Once you've completed that phase, what happens next?
There are several things that would happen next. Next, we would be identifying some of the things that are different in these microparticles. Can these be perhaps removed from the bloodstream to enhance recovery or to lower disease activity, and really just find out exactly how these particles contribute to the development of disease.
What haven't I asked you that's important for you to convey to an audience?
A lot of the people here at this meeting are very excited about CCSVI, and clearly there seems to be a lot of evidence suggesting that CCSVI may be a significant contributor. Now, meetings like this are going to be really important, and the work by people coming to these meetings is going to be really important in the next few years to really establish and validate CCSVI as a contributing mechanism in multiple sclerosis and perhaps other vascular neurodegenerative phenomena.
Thank you very much, Doctor. I really appreciate you taking the time to come. I'm sorry there were some hiccups in there.